My job at the office is to make sure my patients' gums stay healthy and to schedule them for their cleanings on time and make sure we maintain a good treatment plan so that we can establish the health of their gums at all times.
I've been getting my teeth cleaned ever since I've had teeth, and I've never really enjoyed it. But now as I get older and at this dental office, it's more of a pleasant experience.
So when a patient comes in for a regular checkup, let's say, we just go ahead and do your x-rays, we do an assessment of the gums and check the pocket measurements, which is the separation of the gums from the teeth due to infection, and make sure everything looks good and healthy.
Based on the trouble spots of my mouth, we will schedule an appointment. It may need to be sooner than 6 months, or it can be 6 months. She'll instruct me on how to better take care of those spots and to give them some extra attention.
It's so important for patients to be educated on what to do at home in addition to what we do here, and patient education is a major part of what I do.
She always tells me what spots in my mouth are at risk and what I can do to keep those spots from getting any worse or from progressing.
It's very important for everyone to keep a close intervals, keep regular cleaning schedule, so every 6 months max, or every 3 months or 4 months for high-risk patients, so that we can make sure the gums are always staying healthy and keeping the bone, that's the support of your teeth, where it's at. When patients fail to come to get their cleanings on time, or something happens and then they neglect themselves and the health of their gums, the bacteria starts to grow not only above the gum line, but below the gum line. When that happens, we perform a treatment called scaling and root planing, also referred to as deep cleaning, where we numb the patient and we go under the gum with our machines and scalers just a few millimeters below it where that pocket has formed, and remove all the bacteria. The way that periodontal disease progresses is, especially in people who don't floss, the bacteria starts to form between the teeth and starts to work its way underneath the gum. Once those pockets start to form around the teeth and the bacteria is seeping through, it's deteriorating the bone. The bone is what your tooth is being supported by. So once the bone is starting to deteriorate and get infected, the tooth starts to become loose, and that's how you lose your tooth. Healthy pocket measurements for the gums range from 1, 2, and 3 millimeters. 4 millimeters, you kind of have gingivitis. 5 and 6 millimeters, normally we suggest to our patients to do deep cleaning at that time. And if it's anything beyond that, that means it's above my instruments can't go deep enough underneath the gum to be able to clean the area. And that's when we refer you to a specialist. It's a silent disease, so you don't have to have severe pain to realize that you're getting bone loss, which will lead to tooth loss. For patients who are slightly high risk or might have had a history of periodontal disease, we recommend cleanings every 3 or 4 months.
My teeth being clean, knowing that I don't have any trouble areas is super important, and they really provide that extra care here.
More than anything, we treat our patients like our family. And I want more than anything for my patients to have not just a healthy mouth, but I care about the overall health of each and every single person that walks in through our doors.